Today, our group will be discussing our issue: are certain drugs more effective at recovering individuals with long-term COVID-19 symptoms? The two drugs that we'll be discussing is remdesivir, an antiviral, and steroids or corticosteroids. The first drug that we will be discussing is remdesivir. Remdesivir is an antiviral drug that is used to treat COVID-19. Remdesivir is commonly given to non-hospitalized patients with mild to moderate COVID-19 who are at higher risk of progressing with severe disease. The PCFS scale, or Post-COVID Functionality Scale, was used to measure how effective remdesivir is in patients affected by post-COVID syndrome. The legend on the bottom of the graph indicates the score that patients scored from 0 to 1, 2 to 3, and 4. As seen in this graph in Visit 1, between the group of patients treated with remdesivir and those who are not, 123 individuals scored the lowest and were not affected by PCS, or post-COVID syndrome, compared to the 81 individuals without being treated with remdesivir. In the two visits, the remdesivir treatment scores doubled the scores of the non-remdesivir treatment patients. This next graph shows the likelihood of long COVID syndrome. These are just other factors that could affect the likelihood of PCS. As you can see, remdesivir displayed the lowest odds ratio. When a patient is treated with remdesivir, it lowers the likelihood of developing long COVID syndrome. Remdesivir also had the second shortest margin of error. When relating to a bigger population, the results will most likely not differ.
And now for steroids and corticosteroids. Steroids, also known as corticosteroids, are a class of drugs that are used to relieve swelling and inflammation. To test their efficacy, we can look at the coefficient plot graph that was also used for antivirals. Just like antivirals, steroids were close to the baseline of the graph and showed a low margin of error. The graph shows that steroids show a low risk for the persistence of any long COVID symptoms. However, antivirals show a lower risk than steroids. Looking at the odds ratio graph, corticosteroids aren't effective at recovering individuals from long COVID syndrome. The average odds ratio for corticosteroids is about 2.3, and its margin of error ranges from about 0.5 to 5. This shows that there is a lot of variability for corticosteroids, further supporting that corticosteroids aren't effective at treating long COVID syndrome. Remdesivir, however, shows better results than corticosteroids as mentioned before.
In this next slide, the graph presented shows that two groups were tested on, the control group and the treatment group. The control group was given a placebo, meanwhile the treatment group was given corticosteroids. Looking specifically at 40 days after treatment, the treatment group had 55% normal patients, meanwhile the control group had no normal patients and had only about 1/3 of patients with mild hypocemia. Throughout the duration of this study, the treatment group always showed better results than the control group, showing that corticosteroids were able to diminish long-lasting olfactory disorders. Conclusion: antivirals, specifically remdesivir, are more effective than steroids and corticosteroids at helping individuals recover from long-term COVID symptoms. Call to action: to prevent and minimize post-COVID syndrome, it is recommended to get treatment as soon as the symptoms develop in order to reduce the chances of prolonged symptoms.